It's a real pleasure to be here today. And as Tim mentioned, my name is Ken Getz, and I have the privilege of running customer success for both Athena Practice and athenaOne clients. And I can say with authority that we absolutely obsess over our customers. One of the things that makes Athena really special, that Tim kind of mentioned, is that every client at Athena gets a customer success manager, and those CSMs work tirelessly to help their customers adopt Athena, optimize Athena, and more importantly, to ensure our clients are getting the return on the investment that they've made in our software and our services. So today we have some fantastic guests joining us for our customer panel. Amy Roberts is Director of Health Information Systems and IT at Raleigh Neurology Associates, where I do happen to live in Raleigh, North Carolina. And we also have Tina Kelley, Director of Operations at Mountain View Medical Center. So first of all, thank you, Amy and Tina, for joining us. Appreciate you coming here. And so before we begin with the questions, maybe we can just take a moment to learn more about you and your practices. So we'll start with you, Amy. Could you please tell us about your role, your background, and your practice, and how long you've been on athenaOne?
Absolutely. Yep. So I have been, well, in the EMR world for many, many years. I don't want to date myself too much, but let's put it this way. There's some things called logician and some IDX and some things way back in the day. So I really came from that Athena practice world. And really jumped onto athenaOne August of 2022. So Raleigh Neurology is a mid-sized practice. We have about 50 prescribing providers, see about 500 to 600 patients a day, have all different types of ancillary services related to neurology. We have pediatric neurology, MRI, sleep, EEG, pain, things like that. So, but made that jump to athenaOne, and I'm happy to be here today.
Awesome. And before we move to Tina, Amy, can you just share with us a little bit about what makes your practice unique?
Ooh, that's a good one. Well, I mean, we think we're special and unicorns and amazing, right? Um, I would say as far as being a private practice but large, right? And so we're not affiliated with a hospital, but we have three major hospitals in the Raleigh-Durham area that deliver patients to us, right? So we strive really hard. We need a really efficient EMR that interfaces well with all the things. And so I think that as far as like what makes us different would probably be that we've been in practice for about 40 years. So we've been doing this a little bit. And so we're still making it work.
Okay, great. Thank you. And Tina, please share a bit about yourself, your background, and your practice, and how long you've been on athenaOne.
Yeah, sure thing. So I've been here at Mountain View Medical Center for over 10 years. Prior to that, I still kind of worked in healthcare. I was an emergency dispatcher for 17 years before I made that transition solely into healthcare. So a little bit different type of healthcare that we were providing over the phone, but still kind of in that same realm, and just kind of fell in love and had the opportunity to come here to Mountain View and jumped on the chance, and never looking back. So we have been on Athena since November of 2022. So we just hit our 2-year mark last year. I'm super excited. It's hard to believe that it's only been 2 years, actually. It feels like it's been a lot longer than that. Um, but, coming from Athena practice, it was an easy jump for us. And I think now, if you were to go poll our providers, they would tell us that, no way would we go back to Athena practice at this point. We're sticking with athenaOne. So that's super great. We are a small clinic in terms of primary care. So we have 4 doctors of osteopath and 14, or I'm sorry, and then 10 additional mid-level providers, nurse practitioners and physician assistants. We also have integrated behavioral health here in our clinic. So we have one licensed professional counselor that provides mental health counseling to our established patients, which is amazing in this day and age. But we are literally the epitome of family practice. So we were founded by Tim Gray, and we have now since been joined by his 2 sons. So we have 3 Dr. Grays, which is not confusing whatsoever, said no one. But it's really great. We're in a metropolitan area, but we are still able to provide that small town feel of family practice. So our doctors are still known to do house calls periodically for those patients that maybe can't come into the clinic. And it's just really great to be able to see where we are at, multiple generations of family that we've been able to serve here in our community.
Yeah, that's fabulous. And my next question was going to be, what do you think makes your practice unique? But I think you kind of covered that already, unless there's anything else you'd like to add.
No, I think that's our big standout thing. I love telling that to everyone that, I mean, who makes house calls in this day and age really still, right? So
Right.
it's kind of, you just kind of have that picture in your mind of a doctor with his house call bag, and that's what we get to see periodically. It's really neat.
Awesome. Okay, great. All right, well, let's pivot into some of the different areas of interest. I think first up is the whole decision-making and conversion process. And my next question is for you, Amy, is what were the driving forces behind your decision to change systems? How did you go about doing that? Was it a formal process? Did you look at other vendors? What can you tell me?
Yeah, absolutely. So of course we looked at other vendors, right? I think you have to do your due diligence. But what was the driving factor was really not that we were struggling a little bit. So we had a third-party portal that was no longer really being supported through the systems we were using. So our messages were failing to patients. Our servers were old. And so we were on prem for our IT for athenaPractice. And so it was time to update or upgrade or things like that. And so really thinking through, okay, how do we want to do that? What's the next step? And quite frankly, we just felt like athenaOne, when we started looking, had the new features. It's kind of comparing the iPhone 6 to the iPhone 12. It's just there's the next steps, the next things that are available. And maybe even we were a flip phone at the time. We were struggling a little bit with some of our technology. And so we knew that it was time, right? So when we sat down and we started evaluating, we picked pretty much any EMR we could find out there, right, to start reviewing and going through the process. And then we had a committee that was made up of some docs and some nurses, and just kind of a group that we chose and said, hey, we want to meet. And then we narrowed it down based on just conversations to like a top 3, top 4. And then we had demos of those and talked through and really kind of tried as much as possible in a sales cycle process to compare apples to apples instead of having all the different ways to look at things. And so that's really how we kind of decided. And I will say unanimously was athenaOne.
Oh, wow.
Yeah.
That's great. So Tina, kind of similar question for you, but you're coming at this a little bit different angle as a former Quattros Healthco customer that was also very involved in Chug. So why and how did you look at making this change?
Yeah. So in all honesty, we weren't actually looking at making a change when we actually did. The opportunity arose, and we started looking at the capabilities that would be available at our fingertips. And that's what the catalyst was, to really start to think, okay, maybe we should dive in a little bit deeper and start looking more. I do want to preface it with, we love Quattros Healthco. Can't say enough good things about them and the care and support that they gave us while we were with them. But really, one of our core values here at Mountain View is that if it improves patient care, we do it. And so as we were looking at athenaOne, we kind of had that value in the back of our mind and really evaluated every piece and functionality that athenaOne would give us over what we had with athenaPractice. And when we kind of set those, similar to what Amy said, right, like comparing apples to apples, when it came right down to it, the efficiencies and the effectiveness that we added by switching over to athenaOne, I mean, it made the decision for us, in all honesty. We did look at other EMRs as well, but yeah, Athena just stood out in that form and functionality.
Yeah, that's great to hear. So maybe we can talk a little bit about your partnership with Athena as you went through the process. And so, Amy, I'll direct this question to you. Let's talk onboarding. So how did our teams collaborate with you? ahead of the go live and during the onboarding process? What worked well in onboarding? What didn't work so well?
Yeah, so and things are a little different now. I will say, I think just as Athena has been improving, like right, it learn as you every time you do one, you learn, right? But I will say, as we started out, we were assigned a project manager, and they helped us out. They came on site with us as how we had organized them, and walked our facility, helped us figure out, understood us, right? They looped in, I think we talked about the bilingual, looped in the bilingual team, right? To make sure that we were all talking the same language, because sometimes, I say, well, I want to do a flag, and that a flag doesn't exist in Athena, right? athenaOne. And so having those conversations to understand, okay, well, how will this workflow change? And also taking a step back and realizing, just because you did it this way doesn't mean you have to do it this way forever. Like there could be a much more efficient way to do things that better helps the patient, better makes the team member more efficient. So I'm really looking at those processes. We also divided, and Athena assisted with this, divided us into what we call work streams, or what you all call work streams, and I've adopted it here as well. But we had a clinical work stream and a financial work stream. And so we had team members that were in charge of kind of each of them. And then I was kind of the overall project manager on our side. And so that we were able to focus and really dig into things, because it is a lot. I mean, switching an EMR is a big deal.
Right.
And so being able to think through each piece so that all of it got taken care of and was rolled out efficiently as possible.
Yeah.
Yeah. And I guess
Yeah.
maybe what you asked me what I would do differently or what didn't work. I think I kind of skipped over
Yeah.
that.
Like what didn't work so
Yeah.
well?
So we struggled with, and I think anybody would, we thought we were amazing and we were unicorns. I think I said that earlier, that we would be fine, that we weren't going to have any dip. We didn't need to shorten schedules. We're going to be fine. Like, come on. So I think really taking a step back and realizing, okay, go a little bit slow to go fast later. I would have probably done that again. I mean, and Athena recommended it. They're like, hey, maybe think about this. And we were like, no, 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 we'll be fine. I wish that we would have listened a little bit more in that, and maybe not being so, it's not going to happen to us feel.
Yeah, I think that's actually really, really good advice. Another part of this is that there's always going to be some sort of functionality that doesn't exist in the new EMR. So, how did you manage that with your staff and providers?
Is that for me or Tina? Is that
That's
me
for you,
still?
Amy.
Oh, for me
Yeah.
still. Okay.
Yeah. Sorry.
I'm so sorry. Yeah, no, so functionality that doesn't exist. I mean, it's kind of like you're getting something taken away possibly, but if you look at it differently, is it this, it's not even the same anymore, right? And let's try it. Let's give it a moment. I am amazed now because when we have had to log back into Athena practice for whatever reason for something, everybody's like, oh, wow. I think they just at first change is so hard and it's so just difficult to adopt. But just talking through workflows with using Athena's resources right off the bat and incorporating them to help you figure out the workflows, that's really what you got to do, because it doesn't, all the functionality isn't the same, doesn't mean it's wrong. It
Yeah.
could actually be better. Just have to be open to it.
That's actually a great segue, Tina, for my question to you. And Amy hinted at this. No one really likes change, right? So, how did you get the staff behind the project, and what kind of a difference did that make? Are there any specific lessons learned, or what would you would do differently that our audience should keep in mind?
Yeah, I think nobody likes change is kind of an understatement, right? Like,
Absolutely.
um, for sure. And I think especially when you consider longevity of those team members that maybe you have at your practice too, you have to take that into consideration as you're making a change. There are some people that can go with the flow and adapt it to the change and adopt it relatively easily. And you maybe have those that aren't so easily to adapt. So for us, the biggest thing that just propelled everything and really helped streamline the rest of the team coming on board is finding essentially a team champion um, that could speak to it. So we have a nurse practitioner. It's actually, her name is Karen. And I joke all the time that she was our Karen. She was the most outspoken person against changing EMRs. She's been with us for over 30 years. And so she's she's been here since paper charts were a thing, right? And then the reiteration of going to athenaPractice. And then now she was like, I don't want to change. Everything is perfect the way it is. There is no reason. And so we really kind of brought her into the fold and said, you know what? We want you to sit in every single meeting that we have with our implementation team. And granted, we took a full year to implement. So we were meeting weekly with our team to kind of get everything in place for that go live date. And we had her sitting alongside of us the entire time. And so she was able to see and provide feedback as we were creating those workflows on the back end. And then to hear her talk about, yeah, it's not the same as athenaPractice, but here's what it can do. And
Right.
so even those people that maybe weren't as, upset about the change, but maybe apprehensive, she was able to quell any of their concerns just because she was seeing it firsthand and was just our biggest proponent for it. And we ended up doing that same type of thing kind of with each department almost. Just having a champion in each of those departments that can speak to it. That's not somebody in management, because I think too that's a huge thing. Like, it's one thing for me to go out there and sell somebody something, but if somebody that's sitting right next to them day in and day out is doing it, it kind of holds a little bit different weight. So for sure, anything that I would do differently, probably the only thing is I would have found a Karen at our second location. Karen, although she goes back and forth, right? She's mainly in our Forest Grove location. So I think I would have found another one of her in our second location, just so that there was somebody there day in and day out that could speak to it as well.
Yeah, I love that focus. People are the users of the system. The system does nothing without the people, and so they have to be really central to the whole process of onboarding. And it sounds like you came up with some creative ways to deal with that. Um, I'd like to now, if I could, pivot to something that's very close to my heart, which is the customer success piece of this, the post live experience. And so, Tina, I'll stick with you here. How has your CSM contributed to your practice's success since transitioning to athenaOne? Maybe you can talk about your cadence, like your monthly calls, and in what ways has your CSM been proactive, and what does that mean for you?
Yeah, I think it's always a little bit scary, right? When you go, for us coming from Quattro Health Co., which is a smaller organization, right? And we were used to the type of support that they provided. We knew everybody by name. Um, Switching over to Athena, that was probably maybe our biggest concern, was what's that support piece going to look like when we're now kind of a smaller fish in a bigger pond, really. But our CSM, having someone assigned to us that we can know by name, and I have her email, I have her, phone number, her direct line, all of those things really made it feel like, okay, we're not as small as we thought we were. In Athena's eyes, we're actually a pretty big deal. So having her just as that person, our go-to that we can reach out to. Not to say that we don't, submit support tickets to the customer success community. We do, but maybe if we're not getting the type of response we want, or we just want additional support, like, hey, can you take a look at this? Because we don't quite understand what we should be doing. She is there to answer that. In terms of efficiencies and effectiveness in our clinic, those monthly calls are super important, especially for me. As the director of operations, I'm meeting with my providers every single month to talk over what their efficiencies are in terms of seeing patients. And the reports that she's able to provide to us every month give me insight into that. So I can sit down with them and say, hey, you know what? Great. You saw this many, encounters this month. Love it. Why aren't you closing them in a much quicker rate? Like, you're kind of lower on these things, and just that level and granularity of metrics that she's able to provide. Although I could probably get it myself within Athena, it's great just to have her walk me through it. And that way I speak even much more intelligently to my providers when I'm sitting down with them and saying, hey, great, I see that you're not using some of these enhancers or these, I can't think of what they're called, accelerators. There it is. Let's talk about the why. Why aren't you using them? And it really opens up that channel of communication and lets me help them become better and more efficient and serve their patients better and efficiently.
Yeah. And the CSMs have a broad view of other clients and practices, oftentimes of the same size or in a similar market or specialty. So they're able to sort of bring to light best practices that you may not be aware of, and insights from data that you just may not be aware of, right? So that's definitely one of the value adds of a CSM. Amy, similarly for you, maybe you can share a specific instance where your CSM has provided support or resources that significantly impacted you. Can you tell us about not just CSM, but also overall support, the CSC, the success community?
Yeah, absolutely. I really like my CSM. I really, really like them. He and to your point, has a lot of specialties that like a lot of the neurology specialty, right? So it's like we can, and he also, so one of the big things for me and kind of a game changer that he has done is he helps with the user group. So he jumps in and he is kind of that sound person from the Athena side when we meet in a user group. So when all of the neurology practices meet, we all can collaborate with him. And then he's able to provide to all of us at once as we're collaborating, like, hey, you know what? There might be coaching for that, or there might be an opportunity where we can take a step back and do more. I mean, he absolutely is also my escalation path if I ever have a question on things, or if I'm struggling with how to word how I want to do an interface, because right now I'm trying to figure out how I want to do one. And I'm like, I don't know how to even open the ticket to ask for it. He's a great sounding board for that kind of thing. But as far as helping like our practice get connected to the other practices that are neurology based, like that's huge for us. And so I really, really appreciate him.
Yeah. The CSMs on the athenaOne side have the benefit of additional tooling and insights that you don't have in athenaPractice. So there's a lot more of an accentuated value add that a CSM can bring to that relationship. And I definitely see that on the athenaOne side. And I also know that both of you have been involved in user groups, and I'd love for you both to comment on that. Maybe Tina, you can comment first, and then Amy.
Yeah, I'm almost embarrassed to probably say how many user groups I belong to. I don't even know what the actual number is. Um, but yeah, I think especially when we're looking at primary care, right? Like having a group, I'm going to speak to that user group, that I can go to and ask questions and best practices to that is specific to what the level of service that we provide is super beneficial. Granted, we have contacts with other primary care clinics in our state, but sometimes it's great to have even a broader view of there's so many other options and ways to do things that maybe no one else is thinking of. So just having that group as a sounding board, or even honestly to learn some workarounds, right? So it's super great. And I love we have monthly calls, which are phenomenal. Not just to, again, that sounding board, but also to learn of functionality that maybe we haven't become familiar with. And so we haven't fully grasped it yet. And then it's kind of that catalyst of, yeah, we should put some calories into this. An additional user group, I think I'm a customer engagement or patient engagement user group. I just started attending that one. And that one has been phenomenal just in terms of how can we really get our patients more engaged with our practice on a different level instead of just coming in to the clinic. Like how can we reach out to them? How can we use enhanced check-in? How can we use the portal and communicator more effectively? That has been really great to changing some of our workflows as well.
I saw you on that.
Amy?
Saw you on that last month. Good. I can go. Yeah. So, same. I have a lot of user groups that I'm in. I think the more you engage with other like-minded practices, the better you're going to be. I do feel like, I mean, Athena is a partnership and they allow you to set up the relationships with others. And so why wouldn't you take advantage of it? I mean, I'm in a reporting user group, right, to help with figuring out different reports and how I can utilize the system even, more than I am now. I have a lot of light bulb aha moments with even like our neurology user group. I'm in the peds user group because why not? Because we have pediatric neurology. And so there's just across the board, and they're all a little different. Some are really big and they end up having more of a presentation style. Some are very small, and like our sleep one, I feel like everybody was asleep last month and we only had a couple, but we had a great conversation because we could just chat with each other and try to figure, okay, who's doing what for what. So, but yeah, user groups have been great, and just the entire success community too. I will call out, I mean, not just the group side of it, but then I think Tina had mentioned success community earlier, just the amount of articles that you can go in and discover things. And then if you want to know more, you can go to that community and ask and say, I have a question about this. Has anybody done this yet?
Yeah. Yeah. I'm really impressed with the ecosystem of our user groups, and yeah, our CSMs are part of the leadership of many of them. We are. It's not really marketing, and that's usually sometimes a problem with a user group is it becomes like a marketing thing, and it doesn't feel like that's the case here. They're really more organic, customer led, CSM led, and really focused on client success, which is great to see. Let me switch gears a little bit and ask for you both to share more about your experience on athenaOne. And Tina, we'll start with you, and maybe you can provide a few anecdotes about how the athenaOne mobile app or communicator or just other tools that you've used have improved your workflows compared to what was available with athenaPractice.
Yeah, I think athenaOne Mobile, right, many of our providers are just utilizing that every single day. And it's funny because I think when we first initially made that switch, they were just like, I can't imagine having my phone and doing anything on my phone. Like, why would I want to do that? And then it just took that one time of them recognizing, oh, wait a minute. You mean I can quickly, look at a patient case and see that, oh, this patient needs a prescription. Great. I'll send the refill right now in between walking between exam rooms. So I think that has been for them just a really great piece of functionality that they've been able to utilize, which then has helped to them manage that inbox a little bit as well, right? Because they can do it when they're not just sitting at their desk, but also on the go. For me, operationally, one of the biggest things is some of that AI that's built into athenaOne. I think it was mentioned quite a bit during the demo. But a big piece, especially for our front desk personnel, is that insurance eligibility, checking that every time a patient comes in and having that be automated to, checking it 2 days before a patient comes in the door, phenomenal. But probably my favorite piece, especially we are in January, right? So everyone's insurance plans seem to have changed this year. It's crazy. But we're wanting them to bring in their insurance cards and get new pictures of those. We've now removed that guesswork from our front desk through the functionality built into athenaOne. So when they take a picture of that patient's insurance card, Athena is able to read it and determine not just the carrier, but also the individual plan, and then pick that correct plan and carrier within Athena to make sure that we are billing the correct insurance once we send those claims out, which has then minimized the level of hold that we're getting back or denial. So probably that piece of functionality is the biggest impact that we've had, just taking that guesswork out of it, right? There's so many plans out there to choose from. And if one less thing we have to try to mitigate our way through, the better.
Yeah. And similar to you, Amy, how have these tools changed the way your staff interacts with patients or manages their daily tasks?
Yeah, I mean, the one thing that I feel has changed us in just as an entire practice and just made us better from a patient care perspective is closing that order loop. So in athenaPractice, some of it was by old design and how we did workflows, but we didn't do a great job of closing that order loop. When a patient would get an order, it wasn't a great clean process for us to follow along, where Athena has a lot more automated. athenaOne has an automated process, right? So it is very, you order and then it goes through a alarm system. So if like you don't get the results off of an order after a certain amount of days, it will alarm back and alert the staff. We didn't have any of that, right? So unfortunately, things being missed, right? So the biggest pull for us, and I think Dr. Clark even mentioned it, but that is huge for us. I mean, that is patient care 101. Are we making sure our patients are going and getting those things done, getting those tests done, and they have to have that MRI before they come back so that we can have the next discussion and decide if an infusion is the right answer, right? So for us, that to me, that automation of that, just, I mean, if we had like hours and hours of people putting time in to figure out if orders had been completed and what has happened and things like that. So having that all in that loop has been amazing. I will say, and I also have that whole Tina, like I for me personally, I love the mobility of athenaOne. So like if I have to go log in somewhere else, like I don't have to be net at my computer, right? I can hop on a tablet. I can be on my home computer if I had to and go to the website. Like, I mean, yes, I have the MFA and I have protection there, but I love that. Like, I love the ability for the doctors to be able to maneuver around. It's a lot less tied to your desk feeling. It makes it just more efficient.
Awesome. Well, Tina and Amy, we have so many questions. I don't, unlimited time, unfortunately, limited time, but thank you so much for your thoughtful responses. Please stay with us, though, for a few more minutes. I think we're going to bring Tim back on. And Tim, if you could join us again and bring up any questions that came through.
Absolutely. Thanks again. Great conversation so far. Did get a couple questions. So, Tina, I think I'm going to come to you with this one. So there was a question about provider experience. Can you talk a little bit about how your providers, how they do with the EMR and how they made the switch over as well?
Absolutely. Yeah, I think I hinted at this a little bit, right? Like, I think if you were to go and pull them today, 2 years after we've gone live, none of them would jump at the chance to go back to athenaPractice. It's funny, Amy mentioned too, right? Like anytime you have to go back into athenaPractice, we've now been on athenaOne for enough time that when we do go back, we've kind of all forgotten how to maneuver in it, actually. So it's almost like it's a whole new learning curve if we have to try to go find something in there. But yeah, absolutely. I think just the amount of streamlined efficiency that is built into athenaOne has made their experience 10 times better. They're not having to, the amount of big things, which if there's any providers, I'm sure, or if you work with the providers, you've heard this, like the amount of clicks that they're doing any given time period is a huge thing. The less clicks, the better. And with athenaOne, there's less clicks for them. We can build so many efficiencies into their daily workflows. They're not having to go and decide which screening questionnaires they need to do for a specific encounter, because once that encounter is selected, all of the screening questionnaires populate for them and they're ready to go. I mean, orders can automatically populate dependent on the type of encounter or type of visit that they're doing. So all of those little efficiencies have saved them so much time that they can now focus where their time is most important, and that's with the patient, seeing them, caring for them, building that relationship with them.
Probably improves your life too, doesn't it now, Tina?
For sure, yes.
Awesome. Amy, you alluded to this a little bit before anyway, but there was a question here about, how is Athena viewed in your minds as a partner and a collaborator?
Absolutely. Yeah. So for us, I always kind of take that vendor is my teammate approach. And that is so key in this, right? And the fact that Athena has proactive communication that comes out as things are going on, the amount of training, and I will say even tacking on to the end of Tina's answer, like the amount of training that is given for provider onboarding, for user onboarding, things like that, like if there's there's quarterly releases. So if there's a quarter release, the information that is given to us to be able to help out, that to me, that's being a teammate, right? Like they're giving us, you guys are giving us, Athena is giving us what we need to turn around and get that information out to everyone. So I love that concept. I love being able to work together to figure out, because you guys want us to succeed, we want to succeed. So it's nice to have that everybody in the same team move forward. And I love that.
Awesome. And I have one more question here, Ken. I'm actually going to throw it to you, and then I'll send it back to you to wrap up with the panel as well afterwards. But there's a question here about how does Athena communicate new features, functionality, releases, that kind of thing, and then how do we make sure that our customers are trained and ready to take them on?
Yeah, it's a great question, and Amy sort of talked about this a little bit. Athena Health has a specific cadence where we do major updates. It's a very predictable schedule, and at least once a month prior to the release of new functionality, we publish something called a release center that provides in-depth details and video guides for all the upcoming changes. And what's really cool is it's sortable by staff position affected by the change or the product that's being updated and by the level of change management and training that's required for each update. I think that's really novel how we do that. For particularly heavy changes that require a little bit more change management, like some of the recent scheduling changes, we send automated emails to practice staff, specifically to staff who are listed by their practice as responsible for training to make them aware of upcoming changes and resources that are available. Additionally, to further support clients during releases, we hold a release walkthrough webinars to highlight key features that all Athena clients are able to attend or watch on demand. Our CSMs are very well equipped. They're provided with training and user guides, which they can then curate and with key features for their clients to share with staff as part of their regular touch points. And the user groups will also be supported and will also cover highlights and upcoming specialty specific changes and new functions. And lastly, just one really cool thing we do, about 10 business days prior to our release, clients are able to begin testing key features in a preview environment. So they're able to ensure that they're comfortable and aware of the changes or even make their own training videos for a more personalized approach for their practice. So we really do roll out, I think, the red carpet when we do major releases. And to me, it's a real advantage and value add within Athena.
So releases no longer cause PTSD, Amy and Tina, for your staff. Is that right?
It's pretty smooth. Yeah, I mean, we can get ahead of it and talk through any changes and things like that. It's definitely better.
Awesome.
All right. Well, we just have a few minutes left, and I'd like to ask one final question to each of you. What is the best advice that you can give other Athena Practice customers as they consider making this critical change to their business? And Amy, why don't you go first, and then Tina?
Yeah, I will say think through how you want to implement, like what you want to continue, what is not working in the old system. I literally make this joke every time I talk to somebody: don't put an ugly couch in a new house, right? We were building a house during the Athena implementation. I don't know why, but at that time, I'm like, can we just not put our ugly couch in it? Like, it's the same concept, right? Don't do what you've always done. Be open to opportunities for improvement, right? Athena does so many things well if you don't fight it, right? Don't fight the system because it does some automated things that will just make it so much better for your team member or your teammates, and it's just better. So as far as that goes, I would say be open to ideas from your implementation team. Changing an EMR is hard. It's tough. I wouldn't necessarily want to do it every year. But just know that you're going to get there. Be patient, be calm, and be open to anything that the Athena team is recommending because they've been there, done that.
Absolutely.
Go ahead, Tina. Same question.
Ditto what Amy said. No. I think, Ray, I spoke to it. Find your team champions if you're going to make that switch. And I think really bring your team alongside of you. EMRs have forever been just about the provider experience, but I think that's where athenaOne kind of sets itself apart. It's not just the provider experience, it's literally every team that it takes to make a clinic or a facility run efficiently and effectively. They really pinpoint each of those individual places. So I think bringing all of your team members alongside of you as you're walking through this is super important because it affects everyone, and you want to make sure that it's the least amount of boat rocking as possible. And it will be. I mean, like Amy said, change is, we said it multiple times, change is hard. But just because it's different doesn't mean it's wrong. So changing your mindset of, yes, we may have done something the same way for the last 12 years, I think is how long we were on athenaPractice. Doesn't mean that was the best way or the correct way or the only way. And really athenaOne has opened our eyes to kind of not just what we were missing, but what the possibilities are as we're moving and growing and really kind of going forward into this ecosystem of healthcare and the changes that are coming about within it. And that's, if you want to be at the forefront and be ready to provide your patients with the best care, athenaOne and the vision, everyone is so sick of hearing me talk about this when they talk to me about EMRs. that I know. It's just that idea that athenaOne is constantly looking for ways to improve the experience for everyone and improve the care that you're able to provide to those patients. And I think that speaks volumes for any entity that you know, at our core in healthcare, that's what we want to do, and that's what athenaOne strives to give us. So
yeah, that's fabulous. Well, thank you, Tina and Amy, for your thoughtful responses to all the questions. It was a pleasure having you join us today for the panel discussion.